It's always a question, should we prevent infectious diseases or not? In a survey that I did with a couple of colleagues from Federation University some years ago, which was published in Homeopathic Links in 2015-2016 series of articles, it showed that about 10% of homeopaths surveyed from around the world didn't believe that we should prevent infectious diseases. Instead, we should let the person get the disease and treat. They felt that's what Hahnemann himself intended, even though Hahnemann himself used homeopathic immunisation, initially using belladonna to prevent as well as treat scarlet fever. My view is this: there are some diseases which in healthy people are relatively very mild. Measles, mumps, rubella, chickenpox are examples. In Australia, everyone of my generation, we got those diseases. We stayed away from school for a week or two. We were looked after by mum at home and the diseases passed. And most of us would have had lifelong immunity as a result, and certainly no long-lasting problems. But from my point of view, even though I've treated over the years hundreds of cases of whooping cough in young children, I'd rather not have to treat whooping cough in an infant. And I certainly have no wish to have to treat meningococcal meningitis. The person needs to be in an ambulance on the way to hospital as soon as possible. So I believe there certainly are some diseases where prevention is much more sensible than treatment. So then we must ask the question, if this is the case, what's the best way to do it? Once again, from that survey, about 10% of practitioners said they believe constitutional prevention was the best way of doing it. But to be quite honest with you, I've seen very, very healthy people get simple infectious diseases. If we wish to maximise the level of prevention against a particular or targeted infectious disease, then using a disease-specific method of prevention is much preferred. To my best knowledge, there are two main types of disease-specific prevention available: vaccination and homeoprophylaxis, or homeopathic immunisation. I am not anti-vaccination. I have patients who vaccinate, they have my full support. But I do believe that parents deserve honest information about both options. And I've devoted the last 30 years to trying to collect information, to collect data from around the world to do that. And the book that we're looking at is the culmination of 30 years research. I hope you find it valuable in your dealings with patients, or if you are a parent, in your journey of exploration. Thank you.